Welcome back. Well, we know that Pfizer's vaccine is now available for those who fall under the phase 1 of the distribution process. The distribution of Moderna's COVID-19 vaccine is now underway. And joining us to talk more about what the vaccine rollouts mean specifically for the Latino community is KUSI contributor Esther Valdes Clayton. Good morning, Esther. Nice to have you on.
Good morning.
And of course, we're zeroing in on the Latino community because we know, as through our reporting and numbers, that Latinos have been disproportionately affected by the coronavirus. Is that right?
That's absolutely correct. Here in the state of California, where Latinos are 40% of the population, they account for more than 60% of the coronavirus cases, as well as the mortality rate tends to be 2 to 3 times higher than their white counterparts. So we are seeing a disproportionate impact on the coronavirus pandemic and Latino communities. And of course, the root causes are many. One of the dangers in conflating Black and Latino rates of coronavirus infection with skin color is precisely because it doesn't go to the underlying motivations that cause the infection to be more severe in the first place, such as high blood pressure, such as obesity, lack of access to quality health care, crowded housing environments as well. All of these lead to higher infection rates, and also the higher representation of Latino populations in essential working types of industries, such as maintenance, such as restaurant work, such as our frontline workers who provide healthcare access for our elderly patients in nursing homes. All of those don't necessarily equate with race and skin color, but they are characteristics of a Latino population that has been disproportionately affected.
I'm glad you're pointing that out, because even the governor said last month that Latinos, as well as African Americans or Blacks, who have been disproportionately affected, should be among the first to get inoculated. My question now becomes, though, I'm Latina. I come from a very traditional Latino family. There is a lot of distrust. I don't know how else to phrase it, but there is a lot of distrust in believing that the vaccine will work. I want to get your take on that, why you think that is, and what we should be doing. I mean, if we do come across maybe some of our family members who are just not a fan of medicine.
There's several factors attributing to the high levels of distrust. We note that a lot of surveys are showing up to 1/3 of Black Americans are distrustful of this vaccine. Among Latinas, it's even higher than their male counterparts, because we don't know a lot about this vaccine. For example, what we do know, it was achieved in a record number of months. Typically, the mumps vaccine in the 60s was achieved in about 4 years. This has been a matter of months. We don't know what the reproductive consequences are on Latina females. We don't know what the consequences are on their progeny as well. Also, we have a history in the United States of racial experimentation. We don't have to look further than in the 1940s with the Tuskegee experiment, where Black men were knowingly infected by the US government, and subsequently dozens of them died because they were infected with syphilis. And of course, the very notable experimentation of an African-American woman, Henrietta Lacks, who, unbeknownst to her, she had cancer and her cancer cells were used for experimentation. So there is a lot of distrust, and rightfully so. We don't know why Blacks and Latinos are being the first in line, when what we do know is that elderly people are disproportionately being killed in the nursing homes because of the lack of quality access care. There's also healthcare workers that should be prioritized. Also, there's an argument for teachers and frontline educators to be the first to be inoculated. And also there's a legal impact here, Liz, as well, in terms of whether a race-based vaccine rollout would even hold muster in the Supreme Court, where as a nation, we're trying to have racial equity talks, but by focusing unnecessarily on race and skin color in a vaccine rollout, we're really not addressing the underlying core characteristics and behaviors that cause the coronavirus epidemic to swell in numbers among the Latino community. Poverty, overcrowding, intergenerational housing. How is the government actually solving and addressing these core issues? We know that skin color doesn't equate with infection necessarily. It's the underlying factors such as smoking, the lack of access to quality nutrition. All of this leads to a greater amount of distrust. But again, the equity portion could take several facets.
Yeah.
Here in the state of California, the governor has said that there would be a transportation focus for Latinos who don't have access to a car or bus routes to be able to take the vaccine. They would have a mobile vaccine rollout program here in the state of California. So there's many facets to this, but what is very problematic is that we have to follow the science. And we know that and we can't follow this and have race be the top-notch factor in deciding who and who doesn't live, especially in a historic pandemic.
Yeah, this is a very interesting perspective. I'm so glad we had the opportunity to chat with you. Esther Valdes Clayton, thank you so much for your time on this Sunday. By the way, in case I don't talk to you, have a Merry Christmas, Happy Holidays, and Happy New Year for that matter.
Thank you, Liz. Same to you.
Take care. Thank you.